Hi, I'm Andy Peachy, the Academic Unit Head for the Department of Health Sciences here at James Madison University. I'd like to spotlight the recent work of two of our alumni, Anthony Walton and Sarah Alvarez, with Professor Stephanie Baller. They published their findings in the Journal of Consumer Health on the Internet, investigating the security risks associated with wearable fitness devices. Anthony and Sarah, will you tell us more about your project?
So our research project was all about mobile health monitoring devices and the awareness and perceptions of data security and safety. It was targeted towards consumers, but specifically future health practitioners. And we were really trying to see if people knew what type of information was being collected, if they were aware of any privacy or security concerns.
So this project began as part of our health research methods course. We picked this topic as one of our group members already had an interest into cybersecurity, and this topic kind of blended all of our interests together, and we also felt like it was a pretty unique area to explore.
Why should the public care about this research?
So this research is particularly important just because there's personal health information involved and it's not regulated by HIPAA like most health information is. When it comes to mobile health monitoring devices, they aren't regulated the same way that something like measurements taken at a hospital or measurements taken at your doctor's office are.
This research is important because mobile health monitoring devices are being integrated into our daily lives, yet there is still such little understanding of the actual risks associated with them.
I'm glad you were able to bring awareness to this topic. What did you learn throughout the process?
So this process gave me lots of insight into the world of research and publication. Going into this project, I had a vague understanding of this just from what I learned in the classroom, but however, in actually working through the process, I learned just how long and nuanced it can be. But we were pretty lucky and our manuscript was fairly well received by the publishers.
Having a paper published was a really big deal for me. It's something that I did not see for myself when I started college because I thought it was for the most elite, most professional, top tier. That's one really big thing that working on this research project has done for me.
So the skills for the understanding of scientific literature that I developed throughout this project have already helped me in my career. Earlier this year, I assisted in a publication by accumulating data for a literary review regarding the quality of recent anatomical publications, which is set to be published in the Aesthetic Surgery Journal.
That's fantastic. Congratulations. You both graduated from JMU last year. What have you done since then?
Right now, I'm getting certified through a hospital for a PCT program so I can get patient contact hours. It's really fun. I actually just passed my exams this past week and we hit the floor next week. So I'm actually gonna be working with patients as of Monday. It is very exciting. It is just one small step in the road to grad school. And then after grad school, I plan on getting board certified as a PA.
I graduated from JMU with a pre-PA minor, but I've now switched to a nursing route and I'm currently waiting back to hear from an accelerated nursing program. I know my goal is to be a mid-level provider of some sort. I have just yet to decide exactly what that job will be for me.
The health sciences major at JMU prepares students for lots of future careers. Why did you choose health sciences?
I chose JMU Health Sciences because it was pretty much the perfect place for me academically. Going into college, I wasn't 100% sure exactly what I wanted to do. Still, I'm not 100% sure exactly what I wanted to do, but always knew I wanted to go into healthcare, so this major really gave me the ability to explore all of my options while still earning my degree.
We got to study everything from biology and chemistry to environmental science, as well as psychology, pathology, epidemiology. So we got to dabble in a lot of different fields. So I feel like coming out after graduation, I have a really good understanding of how things are interconnected and how things work as a whole picture rather than just getting a few bits of information on one major topic.